Welcome to our video on how to prepare for surgery as an anesthesiologist and to clear up some misconception in anesthesia. Surgery can be a stressful time for both patients and medical professionals, but with the right preparation, it can go smoothly and safely. In this video, we'll discuss the steps an anesthesiologist should take to prepare for a surgery. The first step is to review the patient's medical history. It's important to understand the patient's overall health, any underlying medical conditions they have, and any medications they are taking. This information is crucial in determining the appropriate type and dose of anesthesia. Once the patient's medical history is reviewed, the anesthesiologist will meet with the patient to discuss the anesthesia options available and explain the risks and benefits of each option. This gives the patient the opportunity to ask questions and express any concerns. Next, the anesthesiologist will develop an anesthetic plan tailored to the patient's specific needs. This includes determining the type of anesthesia to be used, determining the patient's vital signs, and identifying any potential complications. The anesthesiologist will also check and prepare any necessary equipment and medications. This includes ensuring that all equipment is in good working order and that the correct drugs are available. The anesthesiologist will also make sure they have any additional equipment or supplies they might need on hand, such as oxygen tanks or other emergency equipment. It's important for the anesthesiologist to review the surgery and the patient's anesthetic plan with the surgical team to ensure everyone is on the same page and to understand any particular consideration of the surgery that need attention. On the day of the surgery, the anesthesiologist will meet with the patient and check vital signs. They will also administer the anesthesia and monitor the patient's vital signs throughout the surgery. After the surgery, the anesthesiologist will continue to monitor the patient's vital signs and administer any necessary medications to manage pain or other symptoms. They will also discuss the patient's recovery with the surgical team and provide any follow-up care as needed. Preparing for surgery can be a complex process, but by following these steps and working closely with the surgical team, an anesthesiologist can ensure that the surgery goes smoothly and safely. If you have any question or concern, don't hesitate to ask your anesthesiologist. They are there to make sure you have a safe and comfortable experience. Next is myths and misconceptions in anesthesia. Anesthesia is a critical part of modern medicine, but there are a lot of myths and misconceptions about it that we want to clear up. Anesthesia is a medical field that many of us know little about. However, there are a number of misconceptions about this field that are worth addressing. We will take a closer look at some of the most common misconceptions about anesthesia and set the record straight. One common misconception about anesthesia is that it simply puts patients to sleep. In reality, anesthesia is a complex field that involves the administration of drugs to control pain and other sensations during surgery or other medical procedures. Anesthesiologists use a variety of different drugs, depending on the type of procedure and the patient's individual needs. These drugs can range from general anesthetics that cause deep unconsciousness, to regional anesthetics that numb specific areas of the body, to local anesthetics that numb a small area of skin or mucous membrane. Another misconception is that anesthesia is not safe. In fact, anesthesia is very safe when administered by qualified and trained professionals. Serious complications are rare, and the benefits of anesthesia in allowing medical procedures to be performed safely and effectively far outweigh any risks. Anesthesiologists are specially trained doctors who work closely with surgeons and other medical staff to monitor patients during procedures, ensuring that they are safe and comfortable. A third misconception is that patients will not be able to wake up after receiving anesthesia. While there are some instances in which patients may have difficulty waking up, this is extremely rare and is almost always due to an underlying medical condition rather than the anesthesia itself. Anesthesiologists use special techniques and drugs to help patients wake up quickly and smoothly after a procedure. Another common misconception is that general anesthesia causes memory loss. In reality, general anesthesia temporarily affects the brain's ability to form new memories during the procedure, but memory is restored post-procedure, and any memories formed during surgery are usually not retained by patients due to the short-term amnesia effect of the drugs used for general anesthesia. By understanding the truth about these misconceptions, we can better appreciate the important role that anesthesia plays in modern medicine and the safety and comfort it provides to patients. Another common misconception is that the person will feel pain during surgery even with anesthesia. But in reality, the anesthesia made sure that you are unconscious and unaware during the surgery. You won't feel any pain. The anesthesiologists use a combination of drugs and techniques to minimize the amount of pain or discomfort a patient may feel during and after the surgery. They also use tools to monitor the level of pain, adjusting the anesthesia as needed. It is important to understand the facts about anesthesia and to have open and honest communication with your anesthesiologist or doctor to ensure a safe and comfortable medical experience. Don't hesitate to ask any question you have, and if you have any concerns about your upcoming surgery, please speak with your anesthesiologist to understand what to expect.